Alrighty guys, this is practical number 2, the skull. I will tell you that if you do have friends that have regular anatomy, do not compare your list with theirs. You have a lot more, or a more extensive list. I wouldn't say a lot, but you have a little bit of a different list. So let's get started with the fossa, or the fossa, or fossa. So we have the anterior fossa, so you need to take the skull cap off and look down. So here's the skull cap. You have to take it off and look down into from the top. So this is going to be our anterior fossa here. Our middle fossa is the same thing as the sphenoid bone, which we'll go through in a little bit. And then this is the posterior fossa. Okay. Frontal bone is exactly what we say it is. I'm using 2 skulls because this skull cap doesn't go on, but the inner part of this skull is so much better to see things. So the frontal bone is going to be this bone. We've done this already. Going back to this, taking the cap off, the frontal sinuses. If you get that card, just point to the front, the frontal sinuses. The supraorbital margin. Okay, we talked about that when we talked about eyebrows. This is where your eyebrows are on this margin. You can see it's kind of like it sticks out a little bit. And the supraorbital foramen. These are little holes that allow for blood vessels and nerves to pass. Okay. The parietal bone, going back to the full skull here. Looking from behind, these 2 top bones. This is the left, this is the right parietal bone. Back into the innards of the skull, we have sella turcica, and this is where our pituitary gland sits, actually. Optic foramen, the holes where your optic nerves would go, those are going to be right here. I'm going to tip it right in here, the optic foramen. Foramen ovale is going to be this guy right here. Foramen rotundum is going to be here. And foramen spinosum is going to be right here. There's a lot of holes here. I just picked those 3. Okay. The temporal bone, going back to the full skull. There's one on this side. This is a suture that kind of separates it from another bone. And there is one on, of course, the right side. Right here's the temporal bone. Think of it as your temples. So on the temporal bone, we have the mastoid process. We have the external auditory meatus, which is basically your ear canal. Okay, that would be this. It doesn't go all the way through on the model, but this would be a canal that goes to your inner ear. We have the zygomatic process, or the zygomatic arch. This is part of your cheekbone. Okay. We have where your mandible or your lower jaw meets your skull. This is not really part of it. This is part of the model that allows this to stay on. So if I remove the jaw, in here would be the mandibular fossa. I'll show it to you on here so you can see it without. Right here is one of them. And right here is another one of the mandibular fossae. Okay. The styloid process is this little guy right here. We're still on the temporals. Okay. And then we have the internal acoustic meatus. So that is going to be where the ear hole comes in. So that's going to be, go back to the inside of the skull. Let me take this cap off. Sorry, guys. Where the ear comes in, it's going to be right here. That's the internal acoustic meatus. Okay. The occipital bone is going to be the back, and kind of, if I put this skull cap back on, okay, I'm not doing too well here. This is the occipital bone, and it actually makes up the floor. So all of this is occipital bone as well. It makes up the floor of the skull. Foramen magnum, big hole. That's what foramen magnum means. Okay. If I flip this over, these 2 are the occipital condyles. This is what your skull sits on, C1, the superior articular facets of C1, or the atlas. This is what your skull sits on right here. The external occipital protuberance, it's exactly what it says it is. Occipital sticks out, external. This guy right here, if you feel the back of your head, you feel that big bump on the back of your head, that's what that is. The ethmoid bone, you can see through here. It's actually the medial aspects of the eyes, and then of course it goes up into this part right here. This is part of your ethmoid bone, but this specifically is called the cribriform plate. The palatine bone, I'm sure you've heard of your hard palate, so I'm flipping it upside down. The roof of your mouth that is bony, that is your palatine bone. Removed the mandible, which is your lower jaw, right? These are your mandibular condyles. Here's one, here's another. These are what articulate the lower jaw, the mandible to the jaw, to the skull. Mental foramen, these little holes right here. Okay, these allow again for foramen, allow for the passage of nerves and blood vessels into the bone. Angle of the mandible, pretty obvious. Here's the angle. Intermaxillary suture, there should be a pretty prominent thing right here that connects these two. This is actually two bones down here that actually connect right in here. I don't see it any better on the other one, but it's right here. Ramus of the mental protuberance is here. Okay. Now what I made a mistake, guys. The intermaxillary suture should not be under the mandible. See how it is? It is here. It should be under the maxilla, and I made a mistake. The intermaxillary suture is here. That's why I couldn't find it, because it's on the maxilla. Duh. Okay. Going back to the mandible. Sorry about that, guys. It happens. This flat surface of the mandible is the ramus of the mandible. Ramus is also a bone marking, so you can use this for the ramus. The maxilla is going to be your upper jaw. Your nasal bone is this hard bone here. The zygomatic bone, we already talked about the zygomatic process, but this whole thing is the zygomatic bone. It's actually your cheekbone. Okay. The lacrimal bone, find the holes right here, right in the medial aspects of your eyes. That's where your tears come out. Lacrimal fluid is tears. So right here, these two things right here, those are your lacrimal bones. Inferior nasal concha. If you look inside of the nose, there's some things sticking out of the lateral aspects of the nose. These guys on the bottom are the inferior nasal concha. The vomer bone is the one that goes right down the middle. So let's talk about the sutures. Let me see if I can get the skull cap back on so I can get you guys looking at the sutures properly. There we go. So let's do the squamous suture. So the squamous or squamous suture is on the side. This isn't really easy to see on some of these models, but it separates the temporal bone from the parietal and frontal bones. Okay. The coronal suture, remember that? Direction coronal, so this guy right here, the coronal suture separates the frontal bone from your parietal bones. Lambdoidal, that's how you say it, lambdoidal. That's this back one right here, the squiggly guy right here. It separates the occipital bone from your parietal bones. And of course you have the sagittal one that splits the two parietal bones in half right here. Fontanelles, these are on the fetal skull, which we don't have. So you have to assume that you're picturing them. These, remember I told you you were born as with your skeleton as hyoid cartilage, hyaline cartilage. So you have, your skull isn't fully formed yet. So we have these soft spots called fontanelles, where eventually they're gonna look like this as we get old. This is what your skull looks like when it's really old. These sutures don't ossify until you're quite old. So this is like a cartilaginous material for a long time. But when you're a little baby, there are little soft spots, and you may have, if you have a little brother or sister, if you've ever felt their head, you can feel those soft spots, and that's why you don't drop a child on their head. Anyway, let's do the frontal one. So where the coronal and the sagittal one would meet, that would be right here. This would be what would be your frontal fontanelle. Back here where the lambdoidal and the sagittal meet, right here would be the occipital fontanelle. And then we have one on each side here. Right here, where the coronal and the squamous meet in the front, this is going to be one sphenoid fontanelle on the left side, and then of course we have one over here on the right side. These are your sphenoid fontanelles. The last one is going to be where the squamous suture meets the lambdoidal suture, so around right here. This is going to be a mastoid fontanelle. Notice here's the mastoid process, so hopefully that helps make it easier. And then of course we have the other one on this side. That's going to be where this lambdoidal suture and the squamous suture kind of meet up right here. That would be the left mastoid. You only have to show me one, you don't have to show me both. And that's the skull.